Well, federal health officials have confirmed 2 cases of monkeypox, and they're investigating dozens of others. So for more on the virus and what you need to know, we're joined this afternoon by Dr. Abdu Sharkawy, infectious diseases specialist at Toronto Western Hospital. Dr. Sharkawy, we've talked so much about COVID with you over the past couple of years. Now we're talking monkeypox. So can you put this into perspective? How concerned should we be about monkeypox versus COVID right now?
Well, let's just start by saying they're completely different animals, so to speak. They're totally different viruses on many levels, both in terms of the degree of infectivity and who really needs to be warned and concerned about this. COVID is incredibly transmissible. We know that it has spread rampantly throughout the world, and there are many different opportunities to acquire this. This is a completely different virus. It's a cousin of smallpox, as we know, which has been largely eradicated, and it presents with a sort of flu-like illness within the first few days of contact with an exposed source. That's usually an animal. There have been accounts of sporadic human-to-human transmission, but they haven't been huge. We're not talking about massive outbreaks of hundreds or thousands of people at any point in time. And within a few days of those fever-like symptoms, a rash develops that is very much like the smallpox rash. You get these big sort of pustules or boils on the skin. You may have sore lymph nodes, and the rash eventually will resolve. And the period of infectivity is until someone's rash scabs over. The good news is that people who had immunity to smallpox, which is its cousin and potentially much more serious, there's about an 85% cross-protective benefit there. So believe it or not, people who are over the age of 50, who would normally be at much higher risk for a lot of these infections, they're probably protected, because we know in Canada we stopped giving the vaccine for smallpox in 1972. So not anywhere near the same risk as COVID. I don't think we need to be alarmed. We need to keep an eye on this, though.
And is there any connection between the one or the other at all? I mean, I hear a lot of people, especially, we're seeing the severe acute hepatitis, for example, in the children. Any connection to COVID? We're now hearing about monkeypox. Is there any connection to COVID? Is there anything that is sort of, I don't know, cross-pollinating, or is anything like that? I see that a lot of people raising that question.
I think it's always worth thinking about whether our habits, our risk of transmission has changed in any way, but I think it's extremely premature to draw a connection between the two. We have seen sporadic outbreaks before in parts of Europe, in parts of even North America. This is not new. I think what's jarring some people is the idea that we may be seeing more human-to-human transmission. There's still a limited number of cases there. What's happened in Quebec is probably related to a link with a contact in Boston. There's no indication that something particularly unique or unusual is happening in terms of how this is transmitted. It seems to be mostly direct contact with someone's skin who has a rash, or inhalation of the droplets or aerosols if somebody is actively infected. There's really no indication that somehow our immune system has fundamentally changed, or that we can say this is now sexually transmitted. That would not be something that could be supported right now.
Okay, that's interesting there. So when it comes to the overall situation with monkeypox, then, we've heard that some people who may have been, had their smallpox inoculation, maybe even many dozens of years ago, tens of years ago, 20 years ago, we understand that that may be offering a small level of protection. If you're really concerned about it, though, right now, is there any sense of, going back to your doctor and asking for another inoculation? Is that a way to prevent it, or is it more, you mentioned aerosol, is it masking, or just avoiding, if you see sort of sores and scabs and things like that going close to people like that?
Yeah, great question. First of all, the vaccine for smallpox actually offers a tremendous amount of protection. It's close to around 85%. So it's quite good. In terms of protecting ourselves, we do the same thing that we would do with any airborne and contact-mediated disease from an infectious point of view. And that means it is still reasonable to consider masking. Whether you're worried about COVID or not, I think that's still a reasonable thing to consider. And obviously be careful about who your close contacts are, particularly if they have a new fever and they've got any of these symptoms. it's probably worth avoiding close contact with anybody who has an active fever or a rash until it's determined what the cause is.
All right, that certainly makes sense. Dr. Sharkawy, always good to get your perspective and expertise on these issues. Thanks for your time this afternoon. Have a good long weekend.
It's a pleasure. You too.
All right, take care.